Just a few weeks before the holidays, worries over the Omicron variant continue. The World Health Organization says the strain is spreading at a rate not seen with any other COVID variant at a global scale thus far. And today, new data from South Africa's largest private insurer show 2 doses of the Pfizer vaccine are less effective against severe disease with Omicron than previous variants. So the big question, how does this affect us, right? How does this affect our booster shot regimen moving forward? Bloomberg Intelligence senior pharmaceutical analyst Sam Fazeli joins us now to talk about how booster shots are likely to match up against this new variant. Sam, always a pleasure to get your insights. The message is clear, go get your boosters, right? But is one booster going to be enough against Omicron? And is it too soon to talk about maybe a 4th booster?
Hi, Madison. Thanks for having me on. It's not too soon to start contemplating the potential need for another shot beyond the 3rd shot. But a lot of that depends on exactly what happens when you've had a 3rd shot. So if we look at what South Africa taught us today, and again, I want to stress that we have to take any data that comes from a specific country with a pinch of salt, not because of quality of data, but more about the fact that that's where the data comes from. It refers to what the demographics are. If we take that, the Pfizer BioNTech shot in general provided a 70% protection against hospitalization. That's after 2 doses. If the scientists are right and the data is right that with a booster, you can get protection against infection back up to more meaningful levels of 80, 90%, then that follows that hopefully will also impact the 3rd shot risk reduction for hospitalizations. After that, we'll have to see how long that lasts and whether that wanes, whether there's another variant. Are we dealing with, for a 4th shot, are we dealing with Omicron plus Delta alone, Omicron alone, and a lot of unknowns there.
Yeah, so what does that calculation look like from a public health perspective? How do you decide whether to push people to get more and more booster shots, which could potentially lead to increased vaccine hesitancy, versus just saying we're going to lean into a medication model like with this Pfizer pill that we learned about from your reporting today?
Yeah, the Pfizer pill, what is really nice to see there is as we saw the Merck data, we started all worrying a little bit that as Pfizer goes from an interim analysis, at which point they showed an 85% reduction in the risk of hospitalizations and death, to full analysis, it's gone to 88%. So that's gone the opposite direction to what happened with the Merck drug. So that's great news. The point is, they have said they'll make about 80 million courses this year. That is 2022, we're nearly there. That is a decent number of courses. And then, of course, you've got other companies to which they have licensed the rights to manufacture for the low to middle income countries, et cetera. So that's a lot of doses of courses that would be useful in managing this. But let's not forget, that's in people who've already caught it. We also don't know yet how the drug works against Omicron. I'm optimistic, but we don't know.
Sure.
We also have to consider that catching people in that 5-day window isn't as easy as I think some people might expect, because you have different coverage of healthcare, et cetera. And then, of course, last point, you have to make sure that you know who you're treating and that people take the drug.
Right, of course. What do you think in terms of preventing infection in the first place? What comes first? A new vaccine that addresses the new variants that we're going to continue to see, starting with Omicron, or an additional round of booster shots? Which course of action do you think comes first?
I think the current boosters, number 3, is critical in terms of preventing the rapid expansion of disease. But I have to say, I'm not optimistic that we will ever win the fight of stopping all infections. The antibody levels that are required to do that eventually wane, and people will still get mild, moderate disease. The question is, we need to focus on severe disease. And once we've got enough data with the boosters that we have, do we need to keep boosting people? If we're already controlling the progression of mild disease to progress to severe disease.
Yeah, on that point, Sam, no one who I've interacted with in real life, but a lot of people I know around the U.S. have tested positive. All of them are vaxxed and boosted. It feels increasingly common, at least on a personal anecdote level, that people are testing positive with breakthrough cases. To what extent do you think that we just sort of accept that we're all going to get this eventually? Are we living in fear of, what we saw with the first big waves of COVID pre-vaccination? Or is it right to be really afraid of getting sick with this because we just don't know yet how bad the illness could get?
If you're not vaccinated, I would be worried.
Yeah.
Unless you're 18, 19, 20, and you think you're young and you can do. But even in those cases, you get because it's not just up to the health status of you, it's up to your immune system. Mm-hmm. And they're not always perfect. So, look, I've had a breakthrough infection. A lot of people I know are getting it. So it's almost like saying, I've had a cold twice this year.
Right.
I don't want to belittle this issue, because we have a lot of people who are still not protected properly and a lot of people who are not vaccinated. So the right thing to do is to get those boosters. And please, if people are not vaccinated, go and take the vaccine to reduce the burden on our society.
Right. So it's less that I need to be, terrified that if I see my double vaxxed family members that I might make them sick. It's more a worry for people who aren't vaccinated still.
Yes, also people who are immunocompromised, who are very elderly. So we just need to understand all that a lot better over this next 6 to 12 months about, do we need to vaccinate them every 6 months or every year to protect at that age group, for instance.
I also want to ask you about people who have kind of gone above and beyond when it comes to boosters. At least here in New York, a lot of the J&J recipients, for example, went ahead and kind of took it in their own hands to get booster shots before that was pushed through. Is there any danger or caution to be had when going in for additional shots, particularly before it's recommended at, the federal health agency level?
Yeah, I don't think the people who went in for their extra shots, perhaps with an mRNA vaccine after a single shot of J&J, were wrong to do that, because you want to protect yourself. And now, of course, they're proven right while they're waiting for decisions on how to boost. Maybe a J&J shot would be better for them. It's possible that J&J after an mRNA shot is better. A lot of stuff to work out still, but I would definitely say people should not keep going back in and buying extra shots, because you actually don't know how this same vaccine constantly behaves and whether you're better off getting a variant vaccine at some point in the future rather than repeatedly the same vaccine and pushing your immune system to become fixated on this particular so-called spike protein that you're delivering with the Comirnaty or Spikevax.
Yeah, so where do you net out on that, Sam? Should people be mixing and matching with their boosters?
Well, I kind of had a natural mix and match. I had two AstraZenecas, an infection, and then a Pfizer booster. So I every bit of data that I see, the mix and match, especially adenovirus plus mRNA, seems, which is really the vaccines that we have today, seem to be pretty good at least inducing a good antibody response. What that means in protecting against infection, protecting against disease, we have to work out still.
Sam, it's always a pleasure to be joined by you. You have such incredible insight and context to give us on this virus, and we really appreciate it as we navigate this territory year over year. Thank you so much. That was Bloomberg Intelligence analyst Sam Fazeli joining us.